Hello everyone, my name is Danny Sanchez and I would like to welcome you to my presentation on the Nevada Transgender Healthcare Equity Act, presented for the Healthcare Systems and Health Policy class, instructed by Dr. Michelle Lennox. Welcome to today's presentation on the Nevada Transgender Health Equity Act. This is just more a policy discussion. It's a matter of life and death for many transgender individuals. In my work as a healthcare administrator and through my personal experiences with trans friends, I have seen firsthand the barriers they face when seeking medical care. Today, we're going to explore why this policy is necessary, how it benefits both patients and providers, and why we need to take action now. Now, I know policy discussions can sometimes feel a lot like legal jargon, but trust me, this one matters. This one saved lives. And this one is personal. Have had the privilege of knowing and working with many transgender individuals, both in my personal life and in my professional role as a healthcare administrator. What I've seen firsthand is that access to transgender healthcare individuals is not just a political issue, it's a fundamental human right. And yet, here in Nevada, as much as in much of the US, trans people continue to face unnecessary barriers to receiving the care they need. So today, let's break down this policy. First, why do we need it? Number two, why it benefits both patients and providers. And lastly, why we need to advocate for it now. As everybody knows, our current political climate has changed a lot, and some states are already reversing protections for health for transgender individuals. This is a real problem that we are facing and is becoming a bigger crisis day by day. The Nevada Transgender Healthcare Equity Act is the foundation for all other policies regarding trans healthcare. Why? Because without insurance coverage and state-supported clinics, any triggering programs or healthcare guidelines we create will be meaningless. What good is a well-trained provider if their trans patients can't afford care? The Nevada Transgender Healthcare Equity Act lays the foundation for all other policies related to trans healthcare. Without guaranteeing insurance coverage and funding specialized clinics, any training or guidelines we develop for providers will be meaningless. Right now, many trans patients struggle to afford or access care. And according to the American Medical Association, gender-affirming care is medically necessary, yet insurance companies frequently deny coverage. By establishing clear legal protections, this act ensures that trans individuals receive the healthcare they need and deserve. One of the biggest obstacles to trans healthcare is insurance denial. The National Institutes of Health highlight the lack of coverage for gender-affirming treatments contributes to poor mental health outcomes, including increased rates of depression and suicide. If gender-affirming care is recognized as medically necessary, why is it still treated as optional? The Nevada Transgender Healthcare Equity Act will eliminate the discriminatory barriers by requiring insurance to cover essential care. Transgender Nevadans face unique healthcare challenges. According to the CDC data, Nevada already struggles with disparities in care, and the Human Rights Campaign notes that LGBTQ+ individuals, especially transgender people, experience even greater difficulties accessing quality care. Low-income and uninsured trans individuals are often forced to go without medical attention, further widening the healthcare gap. This act addresses these disparities by expanding access to affordable, inclusive healthcare. Nevada's healthcare system already struggles with disparities as outlined by the CDC. When we overlay these existing issues with the unique challenges transgender people face, it becomes clear that action is needed. The Human Rights Campaign in 2023 reported that while Nevada has made progress in LGBTQ+ equality, there are still significant gaps in healthcare access, particularly for low-income and uninsured transgender individuals. Beyond insurance barriers, Transgender people often face another problem, finding providers who are knowledgeable and affirming. The National Center for Transgender Equality reports that nearly one-third of trans patients have been refused care because of their gender identity, which makes it unacceptable. The Nevada Transgender Healthcare Equity Act will allocate funding for clinics that specialize in trans healthcare, ensuring that patients receive respectful, competent treatment from trained professionals. We also need dedicated clinics that focus on transgender health, not just because trans people deserve specialized care, but because many clinicians lack the training and cultural competency to serve them properly. Research from the National Center for Transgender Equality shows that nearly a third of trans patients report being refused care due to their gender identity. Imagine walking into a hospital, sick or in pain, and then being told that they will not treat you. Once again, this is unacceptable behavior, and this is happening right now. This policy isn't good just for patients, though. It also benefits healthcare providers. Right now, many clinicians want to provide better care but lack clear guidelines. The Nevada Transgender Healthcare Equity Act establishes a framework that ensures insurance companies must cover care and that state-supported clinics are available. A study by Collins in 2005 emphasizes that well-structured health policies create more effective and efficient healthcare systems. This act removes uncertainty for providers and ensures that best practices are standardized statewide. Beyond being the right thing to do, this policy also provides an easy-to-follow framework for healthcare clinicians. Right now, many providers have good intentions and want to offer better care, but they don't have the clear guidelines or institutional support. The Nevada Transgender Healthcare Equity Act changes that by setting a standard that ensures insurance companies must cover care and that funding is allocated to clinics that specialize in trans health. This means clinicians will have structured policies to guide them in treating transgender patients. A major part of improving trans healthcare is education. The World Professional Association for Transgender Health stresses the need to integrate gender-affirming care into medical training. When providers receive proper education on trans health, they report greater confidence in treating trans patients and delivering competent, affirming care. Training will ensure that Nevada's healthcare system is truly inclusive, allowing providers to offer the best possible care to all patients, regardless of gender identity. Additionally, this policy allows us to build upon it. Once we establish insurance coverage and funding, we can expand into training programs, guidelines, and best practices for professionals. As Collins points out in the Public Health in 2005, clear and comprehensive policy frameworks are key to building effective systems. Simply put, this act doesn't just improve care, it provides a roadmap for future progress. Training is another major component. The World Professional Association for Transgender Health emphasizes the importance of integrating this into medical education. Clinicians who receive proper training report greater confidence in treating transgender patients and are more likely to provide non-discriminatory care. If we want our healthcare system to be truly inclusive, we must equip providers with the knowledge and tools that they need. And healthcare policy is often dictated by political will and public perception. Right now, transgender healthcare is under attack across the US. Laws restricting access to care are on the rise, increasing risk for trans individuals. The 2022 US Transgender Survey found that when trans people are denied care, they face higher rates of depression, anxiety, and suicide. This isn't just a healthcare issue, it's a human rights issue. Nevada has an opportunity to lead the way by prioritizing trans-inclusive healthcare policies. Beyond the ethical argument, there's also the economic case for passing this act. Studies show that denying trans healthcare leads to increased ER visits, untreated chronic conditions, and higher overall healthcare costs. Potet found that integrating gender affirming care into medical Standard medical practice reduces long-term healthcare expenses and improves patient outcomes. Investing in trans-inclusive healthcare saves money while ensuring better health for all. Also, a study by Reisner in 2016 highlights that comprehensive healthcare policies that support transgender individuals lead to better mental and physical health outcomes, lower suicide rates, and increased workplace productivity. This means that beyond being a moral imperative, providing transgender inclusive healthcare benefits society as a whole. Now that we understand the importance of this policy, what's next? We must advocate, educate, and push for change. If you live in Nevada, reach out to your representatives and urge them to support this act. If you're a clinician, take the time to educate yourself about trans healthcare and support policies that improve access to care. This act isn't just a good policy, it's a necessary one. With the right advocacy, we can make it a reality. Thank you for listening, and let's get together to make healthcare accessible for everyone. So lastly, what do we do now? We advocate, we educate, and we push for change once again. Thank you for watching. If you found this information helpful, please like, share, and subscribe so we can continue these important conversations. And remember, healthcare is a human right. Let's make it accessible for everyone. Thank you. For reference, these are all the sources that I used to create this material. Thank you and have a good day.